Welcome. And doctors countrywide will go on strike from December 28th after the Kenya Medical Practitioners and Dentists Union declared a 30-day strike notice on November 28th. The KMPDU says that the industrial action is as a result of the government's failure to honor a July 2017 bargaining agreement. Nerima Wekesa with our story.
Solidarity forever for the union.
Doctors countrywide will go on strike from December 28, 2022 after the Kenya Medical Practitioners and Dentists Union KMPDU declared a 30-day strike notice on November 28.
But in the cabinet or in the PS positions, there has to be actually a technical person, a doctor, who can actually advise and make things differently. We appreciate this happening the first time actually since the independence of this country. And that makes us say, how do you expect us to participate in the public healthcare discussions and development if we are not part of it? Are we excluded out of it? We have explored even our ability to have industrial action to ensure that those content of that CBA 2017-2021 are implemented and 2022 CBA 2021-2025 is negotiated.
The KMPDU says the industrial action is as a result of the government's failure to honor a July 27 collective bargaining agreement.
If the next pandemic gets us with a budget of 7 billion, while in the same budget you have allocated 87 billion shillings to stalled projects, white elephants, then there's a problem with this country. It's a lopsided allocation.
Basic salary adjustments, creation of call rooms, posting of medical interns, employment of more doctors and provision of working tools are among the unmet grievances highlighted by the KMPDU.
Overall budget is low. And even if you look at the aspect to implement the UHC, when you say you want to implement UHC as 62 billion, and we know that UHC encompasses equipment, it encompasses governance, it encompasses the human resource aspect of it, which has not all been mentioned, then it is just a fault.
The Ministry of Labour says it has received the industrial action notice. The ministry has urged the doctors to rescind their decision to allow for negotiations. Justifying their decision for industrial action, KMPDU Secretary General Dr. Davinja Bimiji Atela said on November 26, 2022 that the stakeholders involved in the signing of the 2017-2021 CBA had failed to implement issues that they had raised.
We as a union are going to start in engagement and embark in consultations with all stakeholders in the next few months. And these consultations will be to ensure that we have the implementation of the CBA 2027 and actively engaged in the negotiation of the new CBA 2021-2025. And the union will consider all the possible actions and even including calling an industrial actions to ensure that that is implemented. Being cognizant that healthcare is a devolved function, we demand that it's about time that budgetary allocations to county governments be reviewed and increased to address the majority of the issues that have caused industrial disharmony between the health workforce and the employers across the 47 counties.
He further said medical training facilities in Kenya have increased, with 9 universities offering medicine courses, yet the number of graduate doctors being absorbed by the government remains low.
Prepared for that. Do we have enough human resource? Do we have enough PPEs to protect our healthcare workers? Do we have enough mechanisms so that we do not find ourselves where we were in 2020 during the COVID-19? And this is possible only if we put healthcare as an investment and as a priority.
According to Bimiji, several doctors have since retired or resigned but are yet to be replaced. Dr. Bimiji also called on the national government to increase its budgetary allocation to the health sector, saying that increased funds will help address many issues that cause disharmony between healthcare workers and counties.
Out of the health budget, about 56% of it goes to the Ministry of Health, which then do not have employees, but then deals directly with training and policy. But despite that, the Ministry of Health has gone against its mandate that it has been having. It has been citing budgetary deficiency in handling some of the important issues in training.
According to the KMPDU Secretary General, the management and governance structure of the National Hospital Insurance Fund (NHF) also needs an overhaul.
We are calling the Council of Governors to stand together with the unions to demand for the increase of funds to the counties, because we are going to see a situation whereby the doctors, the healthcare workers, the nurses are not being employed. So the public will actually not see any changes in the healthcare.
Bimiji added that KMPDU wants to see stability at the national insurer, saying that NHF will serve Kenyans better if its stability is guaranteed.
Solidarity forever for the union.